We're going to be talking about dysfunction, a lot of different kinds, not just for targeted individuals, but things that we're seeing in our nation. We're going to talk about that. Creating chaos and confusion in a targeted individual's life is key for people who are involved in group harassment. They have to make you dysfunctional. They have to, bring chaos into your life. And for a lot of reasons, they want you to believe that you are dysfunctional. They want you to forget or misperceive the events that are leading to this, scenario in your life. And becoming dysfunctional is actually natural. I've talked about how people become paranoid or they start to read into things. Those are natural reactions. I've always used the example of, maybe a woman who has been exposed to an attack, to an assault. And we'll just say she's 35 years old. And before that, she was fairly easygoing, a normal or so-called normal individual with a normal lock, a normal light above her entranceway to her dwelling. And now after the attack, has guard dogs, carries a weapon, spends time down at the shooting range, has a security system, and is kind of consumed with the idea of self-defense and preparing for some type of an attack. 35 years, and then you have an event that maybe lasts for 20 minutes or whatever, maybe an hour, and it's life-changing. And that's trauma. That's the way trauma works. So, when a targeted individual gets attacked, they become different. They are altered. And the course of their life is different. And the whole idea is to use that to gaslight the targeted individual into believing that they are, kind of losing it, that they are paranoid, that they are, mentally not functioning properly. They have some type of mental illness, or there's an onset of a disorder of sorts. And coupled with, the other chaos that's going to cause the targeted individual to, probably have, difficulty in areas of employment, social difficulties, because there's going to be trust issues. The targeted individual is going to be processing information differently. They are probably going to engage in self-scrutiny for a time, if not for a long duration, because they feel that they are being watched. They feel that they are being, scrutinized under a microscope by all these people, and, it's inevitable. And the result is going to be dysfunction and that chaos, that trauma, the apprehension of being attacked or being assaulted. It can consume the mind of the person who's been afflicted, and that's going to cause them to just behave differently. And, their strengths and weaknesses are going to be affected. And so that their perception of themselves will change. And over time, that's the gaslighting effect. You have to get to the point where you forgive yourself if you find yourself maybe having trust issues, whether it's at your employment or whether it's just social. Maybe it's even in your family. It can extend to all areas of your existence. And, your work performance, it might be hindered. Everything in your life is going to be altered. And you need to realize that that's normal for your predicament. If you don't know that, you are going to use incorrect criteria to, form an opinion about how you're performing and, what your expectations are. You are a victim of trauma. You got to remember that. Okay, that's key. And you have to forgive yourself for being a little paranoid or even a lot paranoid, or for, having problems in one area or another. And when you use lateral comparisons, the whole idea that, only a small percentage of the population is experiencing what you're experiencing means that those lateral comparisons are going to be inaccurate. You are going to be held up next to people who aren't dealing with the stress that you are dealing with. And that goes into the gaslighting. You need to give yourself a break and realize that your reaction to this trauma is only natural. The other thing I would like to bring up is the people around you. People are going to eventually notice that something is different, okay? And you have to remember that, there are red flags, not necessarily to prove that people are in on your harassment necessarily. It could, but just about who you're dealing with, okay? I'd like to use those little trolls that come through the channel. Sometimes they're very vulgar and aggressive. And other times they'll make comments like, you need to get help. You're sick or whatever. It's sad that you're, crazy or whatever. But it's very inconsistent. You have to look at the consistency of the people that are around you. If someone is pointing out that you have become dysfunctional, or that they want to, help you, or they are concerned, you need to look at how they're doing that. Okay, and I've talked about that before. If someone really believes that you are having an issue, or that we'll just say somebody accuses you of having an onset of a mental disorder or whatever, you need to go, to a psychiatrist or something. We'll say that there's trust issues and now you're being accused or whatever. Well, if they really believed that, if they did, they would know that it's not really something that you can control. Okay. It's out of your control. If they really believe that, it's like the little trolls. If they really believed that these people that they are harassing and criticizing have some type of mental disorder, what does that say about them, right? They are sadistic, evil people. And so, you're going to have that with people around you. You're going to receive that criticism. And like I said, it doesn't necessarily mean that these people are in on it. They could be, inadvertently being used. But that's one of the things that you're going to have to notice. And if someone crosses those boundaries into criticizing you and trying to shame you or, whatever, you need to, kind of mention that, hey, okay, if you really believe that, what's that say about you? You need to be consistent, and people will do that. I've noticed that. And what does that say about them? So you're going to be dealing with a lot of different areas, and that's one of them. And, if you shut that down, you don't have to stand up for yourself in an aggressive way or, get into a fight. You just have to point out the obvious, right? Since these people are trying to, appear as they care, well, then, hold them to that. Make them be consistent. And if they really do care, then they're not going to be doing that. So you have to play the game correctly. I know that a lot of you are probably dealing with doctors as well. I don't know the percentage, but I do know that, some of you are probably on disability. And a lot of times you're dealing with people who are into psychiatry, or who are, mental health workers, in one, form or another. And a lot of times you're going to run into people who are not very professional or consistent in that arena. Okay. I've talked about this before. There are some doctors who, are actually pretty good, but most of them are not consistent. Okay. And the criteria needs to be established. You need to, because they may want to talk to you. They may want to bring things up that they are simply not qualified to deal with. I've noticed that in psychiatry. They want to sit across the desk from you, and they want you to tell them everything. They want you to bare your soul. There's no give and take at all. And you don't know anything about these people, and they want you to talk about the most intimate things that have happened to you or that you are thinking about. You don't know anything about them. And on top of that, you have a very limited time to deal with these things. You may have maybe a visit a week or however frequent it is, and you may have an hour or 30 minutes. and they want to open up a can of worms that they're just simply not qualified to, to close. And, let alone 30 minutes to an hour. And there you are. You may leave the office feeling very stressed out. Okay, that happens a lot. And you have to wonder what they're trying to accomplish. It's like they're playing doctor or something. And I've talked about that too. I don't think a lot of these people should really call themselves doctors. It's like the Calvinist evangelists. You have to set the criteria up and remind them of what they really believe. Because people who are into Calvinism, for example, believe that only the elect are going to be saved. And if you're not one of the elect, then it doesn't matter whether they preach the gospel to you or not. It doesn't really matter whether you make a decision or not, because eventually, if you are one of the elect, you're just going to be, saved anyway. So you have to remind them of that. And when you do, they usually back off a little bit. It's like, quit pretending that you're an evangelist, because here's what you really believe. Is that true? And they're, well, yeah, I guess it is. And, as far as, psychiatry, what do most of them believe? They believe that there is no cure. Okay. They believe that all they can do is treat symptoms and make your life more comfortable. And when they're doing that, when they're harassing you and trying to play doctor with you and push you into these areas, you need to remind them, hey, this is going to stress me out. We've got 30 minutes or whatever. Is this a can of worms that you're, really qualified to deal with? And when I leave here, then what? What are you going to do? Give me a bunch of, dope to, to deal with the stress that you're digging up? And, so what you want to do is, ask them, establish that criteria. Do you really believe that therapy is something that can help people, and why? You ask them the question. Also ask them, can people be cured of mental illness, and where are we going with this? Where are, what are you trying to accomplish? For me, I'm your patient. Where are we headed? And that's going to establish those lines of criteria. And you're going to have a lot more productivity if you were in that situation. And it's going to shed light, because a lot of the techniques that these guys are trained to use are just way out there. They might, I'm just trying to help you, and they will be, aggressive or intrusive, or they might try to, shake you up in one way or another and claim that they're, being a guru who's just trying to get down to your emotional level or something. And they're not really, qualified for this. They're just playing doctor. They got on a white coat, and they don't know what the hell they're doing. You got to know that. And you got to remind them of that if they're being inconsistent. Okay. Now we're going to talk about something else. Yeah, this synthetically generated dysfunction that we are experiencing in our nation has become, just too obvious. Now people are talking about their fears. The supply chain issue has become a problem. Store shelves are going to be empty. And conveniently, it's right around we'll call it the flu season, right? Even though supposedly the flu was cured by our current, dilemma, which made no sense at all. And so we are headed in that direction. We are dealing with that dysfunction too. And what am I saying? Well, how aggressive is this situation going to become dealing with the jab? We're headed into that arena, and it's going to be very interesting. How are they going to push it? And are they going to claim an emergency type of scenario? I don't know. I hope they don't. And I know the hospitals in the state that I live in were crying around about that. And, it's just non-existent. Guys, be good to yourselves. Be safe.